Hi, everyone. Welcome back to the Huddle. My name is Cheryl, and I am the Nursing Director at Shadow Health, and I'm joined today by Kumar.
Hey,
Today, it is time for us to huddle up and share our experiences. So, we want to be here to help you navigate this world of screen-based simulation. So, if you're brand new to Shadow Health, or if you're a seasoned user, this huddle is for you. Today is episode number 5, and our topic is professional behavior in communication. So, hi Kumar, how are you doing today?
hey, Cheryl, I'm great. How are you?
Good, good.
So, Cheryl, I had a serious question for you. Uh, Not too long ago, when I was a faculty member, I had a graduate student in my advanced health assessment course, and I had assigned the class to do a history and physical on one of the Shadow Health virtual patients, Tina Jones. And while I was reading the student's transcript, to my surprise, um, and quite honestly, shocked that this graduate student, who was already a registered nurse, was dealing quite aggressively with Tina Jones. And quite honestly, the student was very inappropriate in her questioning and response and remarks to Tina Jones. And I felt like, and I believe that this is a violation of our nursing ethics and practice. And I haven't seen a lot of resources on how to deal with this as a faculty member, and I wanted to get your insight on that situation.
Great. Well, thank you so much, Kumar. That is a very serious question and a great question to ask. So, one of the things as Shadow Health, we can be notified in our system when students use inappropriate language. Our team goes through and looks at comments that do something what we call brick, and they don't get a response from the system because our virtual patients don't really know how to respond to those types of comments. And again, if it's not formulated a question, they're not going to respond. So when we look at our reports and pull those out, we as at Shadow Health know that this has happened, and we can actually determine the user who was saying those things that were unprofessional and inappropriate to our virtual patients. Our view is that this is treated as if you were in a clinical setting in front of a live patient, or if you were in a simulation environment with a high fidelity or low fidelity mannequin where your faculty is present, and that the same behaviors should be used within Shadow Health when you're communicating, as well as when you're in those settings. So it's very concerning when we run across those comments, and we do bring those to the faculty's attention to reach out to them and just let them know that, we had a user from their course, that they need to take a look at their transcript, and they should make the determination on their own of how they would like to handle it based on their institution's own professional behavior guidance. We do not reach out to the student directly. We do have the faculty go ahead and reach out when we find those. But it's concerning because, in an environment that's virtual, you would hope that, the learners and the students and the users are practicing the way they would practice as per usual in their hospital setting or in their primary care setting. However, that's not always true, and we do uncover some concerning conversations that they have with our virtual patients. So I'm so glad you brought this up because, in a profession that is very ethical, we do have folks at times who may say things that are unprofessional, and we want to make sure that we are training them the best that we can and providing them with feedback of how to improve so that when they're out there talking to our patients, they are acting as ethically and responsibly and professional as they possibly can. Does that help out?
Yeah, Cheryl, I really do appreciate that. As we use virtual simulation more frequently in clinical education, we're unfortunately bound to see those things happen. So that's a really great place to start. That's some really great advice. I appreciate that. Thank you.
You're welcome. Well, that's all we have time for today. So we know this may be a new way for you to conduct simulation, and remember, we are here to help. We were there at one time where you are. We were beginners at one time, and so we understand. We want to take this opportunity to thank you again for spending time with us today. And remember, if you like this episode, don't forget to like below, share with your colleagues, and subscribe below to stay up to date. So until our next huddle, take care of each other. Bye.